The rise of cases of cervical cancer in Embu County has been attributed to ignorance and lack of awareness by the people. Embu County Chief Officer for Medical Services, Jen Karimi, said many women in the county are ignorant of their health and only go for checkups when cervical cancer has progressed to a severe stage. Take a look.
According to the report given by the Department of Health in the county, 5,000 people from Embu were receiving treatment on cancer at Kenyatta National Hospital, Nairobi Hospital, and other hospitals abroad 3 years ago. The county disclosed every year 200 people are diagnosed with cancer in Embu County. According to Embu County Chief Officer for Medical Services, Jen Karimi, many women in the county are not aware of what time they should start going for cervical cancer screening, making many live with the disease without their knowledge.
And we have put in place several facilities where we will be doing our screening, our vaccination, our treatment, and also doing health education to women across the county so that they are able to come out, so that they can be able to access the services of being screened, being tested, and also being treated.
The county has embarked on cervical cancer screening and creation of awareness on the disease, which is in line with the World Cervical Cancer Celebration Week, usually marked in January.
Actually, we have several cancers in this county, and it is one of the greatest health burden that we have as a county. And the leading cancers that we have around is one of them is actually the cancer of the cervix, which is preventable because with early screening, we have treatment options which are readily available. The other cancer is cancer of the breast. We have cancer of the prostate, among others, and it is really the largest burden of healthcare across the country, not only in Embu County, but even in Kenya at large. And so we are looking at options of treatment, and we are looking for collaboration with different partners and stakeholders across both the national government and other partners and people of goodwill to come up and help us fight the cancer of the cervix.
The chief officer said the county is targeting to screen 80% of women in the county during the World Celebration of Cervical Cancer Week, which commences on January 16th to 20th.
Actually, we want to say that we need all women in Embu County to come for screening. We do not even want to dwell so much on numbers here, but we are telling the population, let all women come out and be screened. Because when we say percentage, people will say I'm not within that percentage. So we are using layman's language to talk to the people and tell people to come out for screening. Wherever a woman is in our county, let them come out. Actually, we are taking data for the women who will come out for screening so that we may know how many women do we have through that screening of between the age of 25 and above. So actually what we are looking for here is all women in Embu County to go for screening.
According to Karimi, health financing is another burden in the war against cervical cancer in Embu, noting that most of the people who are diagnosed with cancer lack finances, making it difficult for them to go for treatment.
A disease. And what I want the population to know is that treating cancer is very expensive, but mitigating cancer is very cheap. What we need people to do, and that is what we are doing right now, it is to ensure that people come for screening, people are tested, and if you are identified on time, treating you is cheaper than when you come back to us when you are in severe disease. That time, the disease has already started started to do what we call metastasis in a layman's language, ni ya kwamba kansa imeanza kutambaa to the other parts of the body. Kwa hivyo, the best options is we have these people come to the hospital on time, and the way to handle the issue of the challenge of financing is to encourage people to enroll in NHIF program.
The prevalence of cervical cancer is high in Embu, compared to other types of cancer, noting that it's one of the biggest health burdens the county is battling with. The chief officer urged all women in the county to come out in large numbers to get screened, adding that the county has set up health facilities in the county that will be carrying out screening, vaccination, treatment and health education.
The population, people do not really know about how cancer comes about, and that is why as a county we are embarking on that program of ensuring that we inform the public. We encourage the public even to get involved in your health awareness, so that you are able to know at what time do you go for screening of cancer, at what time do you start feeling the signs and symptoms of the cancer. And by so doing, it's by coming to the hospitals and talking to our healthcare workers who can be able to guide you on the early signs and symptoms of having cancer, and especially the cancer of the cervix.